Hi, I'm Janira.
And I'm Julian.
Some of the barriers that impede the adoption of new technology, specifically information technology in the pediatric field, as described in a research article by Dr. Kevin Johnson, are situational barriers which include challenges imposed by the current national health or environment, financial and legal risks with purchasing and using the technology, ability to access the technology, and perhaps the most important, pediatric healthcare practitioners may lack the knowledge or skills needed to use IT. There are several other barriers which the article puts into four categories. The first is situational, or economic realities and external environmental factors affecting access to or use of technology. Second is cognitive and or physical insufficient skills or ability to use technology. The third is legal, regulated or unregulated practices that affect the use of technology. And lastly, attitudinal, behaviors or opinions contrary to those needed to adopt the technology. In regards to situational barriers, time pressure is a very important challenge in the US's healthcare system. PHCPs spend an average of 17 minutes per patient, and studies have shown that it is a significant factor in lowering the tolerance of practitioners in using technologies such as immunization registries and computer-based documentation tools. In addition, IT is not a one-time or a low-time risk. About 80% of pediatric practices have access to the internet, but only 5% of ambulatory care practices use computer-based patient records. Access to IT is influenced by location of practice, rural versus urban, size of the practice, and average age of the PHCPs. Furthermore, in a survey, PHCPs identified a lack of IT training as a major barrier to using technology they consider valuable. For example, PHCPs continue to struggle with using Medline. There also comes the issue of security, patient confidentiality, and liability when using, for example, email to communicate with patients. Lastly, other barriers include a lack of insight about the benefits of IT, their concern about the magnitude of change caused by IT, and their ambivalence about the processes that IT is designed to improve. PHCPs tend to embrace IT solutions in that it results in at least one of these three benefits: more time or money and/or a higher quality care for their patients. Nonetheless, the article concludes that some of these barriers can be overcome by providing education about IT, advocacy, additional research addressing the benefits of IT.
So, as far as outreach technology goes, we thought the best method would be viral videos. Now, one of the best three things about viral videos is the mass spread. So, that could be anything from word of mouth. With word of mouth, a lot of public speakers have issues with hecklers in the audience, people who might like say something and interrupt his speech or whatever. Word of mouth means that they will hear from other regular people, so they can't really attack the base of the information. There's also other media. A greatest example would be Gangnam Style. Gangnam Style started on YouTube and then it went to every single TV show. They started playing it on the radio and all these different commercials. Then there's customization of the video. You can put whatever, whoever you want. Popular political figures, celebrities, whoever you think may be able to best influence the people or best be able to spread the message. Like I said before, they the listeners can't physically give you negative feedback and you don't have to deal with, for lack of a better term, hard-headed people. um, Viral videos, you might say, for example, not everybody has a smartphone, laptop, or computer. Like I said, there's mass spread, so it doesn't necessarily have to be a screening. It could be through the radio, word of mouth, or whatever. um,
And for the for the blog, um, I found one about how to use media as an advocacy tool. And it basically just gives you some steps you should follow. The first one is to identify your audience. Also, research media outlets that cater to your audience. Thirdly, research who the appropriate journalist contacts will be and contact the media outlet. Use public information to contact your target media outlet. Ask to speak either with any journalists you have identified who have already written on your issue, or ask to speak to an assignment editor who can help direct your call. Um, Also explain the purpose of your call. You probably only have like 1 or 2 minutes to make your pitch, so be prepared to concisely state who you are, which organization you work with, and or why are you interested in being in contact with the journalist at hand. Lastly, lay the foundations for future contacts with the journalist. Ask if the journalist would be interested in receiving information from your organization in the future. And one last message is whether your message will be delivered in a press release, an interview, a press briefing, an opinion piece, or through any other channel of communications. You'll need to prepare its delivery.
When you give your spiel, try to make sure you only talk about, unfortunately, try to make sure you only talk about the most interesting things so that way when they accept you, you can get more nit gritty and talk about the less interesting information. Because they're very picky about what they want to show their people. So try, make it Hollywood at first. Okay, I'll cut that
I think
part
that
out.
was good.
That was good. All right. So let me. Do I? Oh no.